So on this scale, I'm going to be performing the sterile dressing change. So I'm going to assess my client's comfort level, review medical orders, and identify my patient, and everything checks out. I am gathering my supplies, gloves, gauze, measuring sterile gloves, my saline, and I'm washing my hands. And I've explained the procedure to the patient, and they actually had this dressing changed 2 days ago, so they're familiar with the procedure. Now I'm applying my cleaning gloves. I'm going to remove the abdominal binder, and I'm going to note the character and the amount of draining on the dressings. And this one actually appears to be pretty clean, so we're towards the end of our wound progression. It's starting to heal, which looks really good. So I'm disposing of that, disposing of my gloves. I removed any gauze that was in there. Now I'm rewashing my hands. And I have my sterile gloves at the bedside. I'm going to be opening them. So I'm just opening them carefully, and I'm not going to put them on yet. I'm going to open my sterile supplies and place them onto that wrapper portion to keep everything sterile. So I'm going to be placing the gauze and my cotton tips as well. And it's better to have too much supplies than not enough, so I'm placing an extra set of my cotton applicators just to be on the safe side. And now I'm placing my gauze. And I'm placing a little bit of solution on top of it. It's just normal saline. I lower the side rail. And I'm going to go ahead and apply my sterile gloves. Squeeze my hands together to perform that seal, and now I'm going to keep my hands above my waist level for the entire procedure until it's done. I'm assessing the size, the color, any drainage, and I'm just going to squeeze that gauze, and using that same gauze I'm going to unfold it, and I'm going to start packing the wound. So it's all packed. Now I'm going to place a single 4x4 gauze. If I needed to use 2, I would, but since this wound is pretty much clean and almost healed, I'm going to just use 1, and then seal it with that abdominal binder and also secure it with some tape. I'm going to remove my gloves, dispose of my supplies, ensure my patient's bed is in the lowest position, wash my hands, and I'm going to record any observations that I made.